Hi, my name is Rocky. I'm a student nurse practitioner. I'll be doing your assessment for today. This video will be uploaded on YouTube for the course. Is that okay?
Yes.
Okay. So the patient presents with epigastric pain, with bloating, complaints of non-productive cough, and a heartburn. We'll start off the assessment with a focused abdominal exam. So first I'm going to be making sure that the patient is properly positioned, supine with the legs supported and the abdominal muscles are relaxed. Next I'm going to be doing my inspection, inspecting the abdominal contour as well as peristalsis of the abdomen. The abdomen is flat, symmetrical with no peristalsis movements or pulsations noted. Next, I'm going to be inspecting the sclera or the color of the abdomen, checking the overall skin, which is even with the chest, no jaundice, no cyanosis noted. Skin is appropriate for race and age. And next, I'm going to be doing my assessment. I'm going to be auscultating. I'm going to be auscultating the 4 quadrants of the abdomen, the aorta, which is above the umbilicus, which spreads out into renal arteries, and then the iliac arteries as well as the femoral arteries, which is down here. So I'm auscultating for the bowel sounds, noting if it's normal, active, hypoactive, or hyperactive bowel sounds. So I'm going to be listening, making sure that I listen a minute for each quadrant. Okay, and those are the 4 quadrants of the abdomen, normal, active, bowel sounds noted. Now I'm going to be listening to the aorta, listening for any bruits or any abnormalities. Checking the bilateral renal arteries. Checking the iliac arteries. No bruits. And lastly, I'm also going to be checking the femoral arteries, which would be right here. After auscultation, no bruits noted. Now I'm going to be percussing. I'm going to be, as I percuss, I'm going to be making sure that you let me know if you experience any pain or discomfort. I'm also watching him to see if there's any signs and symptoms of discomfort or distress. So first I'm going to go ahead and percuss the 4 quadrants or the abdomen. And then I'm basically taking my middle fingers to both hands and I'm tapping onto the middle finger, noting any tympany or dullness. And tympany noted to all 4 quadrants, which is a normal finding. A dullness may indicate some abnormalities. For this case, it's normal. Next, I'm gonna be percussing the bladder, which is in the suprapubic region, and I'm gonna be noting when it's, so right now it's dull in this area. So in this area, I actually noticed a little bit of dullness to the area, which may indicate a distended bladder. The other areas are tympanic, which is a normal finding. Now I'm going to be percussing for liver dullness and finding the bottom edge of the liver. So I'm going to start by the umbilicus, right mid-clavicular line, and I'm going to be percussing up, noting for tympany and dullness. So first, tympany. Okay, right about here is where I note the dullness, and I'm going to mark that area because I'm also going to be using that area to measure the liver span. So I'm going to go about from the third intercostal space. I'm going to percuss down, noting the change between tympany and dullness. So right around here is where I notice where it changed from tympany to dullness, which is about 6 centimeters. So which is a normal finding. A normal finding for liver span is 4 centimeter to 6 centimeter. After checking the liver dullness and checking for the liver span, now I'm gonna be percussing at the spleen, which is located posteriorly at the mid-axillary line. I'm going to be percussing between the 9th and 11th intercostal space, noting tympany and dullness. On a clinical setting, I would be on the other side of the exam table. Okay, so no dullness noted, which is a normal finding. After this, I'm going to be doing palpation. I'm going to start off with a light palpation to all 4 quadrants of the abdomen. So same thing, I'm going to have the patient tell me if it causes any discomfort. I'm also watching for any signs and symptoms of discomfort or distress. So go ahead and let me know if there's any discomfort. And just doing some light palpation around the abdomen. Okay, how's that? Okay. After that, now I'm going to be doing a deep palpation to the abdomen. Let me know if it causes any pain. So checking at all 4 quadrants. Okay. After palpation, deep palpation to the abdomen, now I'm gonna be palpating the liver. I'm gonna be palpating the liver on inspiration. So I'm gonna, around the area where I noted the dullness, the bottom edge of the liver, I'm gonna be palpating on that side, around that area. And go ahead and take a deep breath for me. One more time. And noting that the liver was slightly palpable, and normally the liver can also be palpable to normal patients. And the next one is I'm going to be palpating the spleen on inspiration. So I'm going to go, so in cases that patient that I might suspect splenomegaly, I would start from the right lower quadrant, work my way up to the right upper quadrant. Left upper quadrant. So I would go from right lower quadrant to left upper quadrant. So I'm gonna be asking the patient to take a deep breath out, and then I'm palpating. Okay, and take a deep breath in, a deep breath out. Okay, deep breath in. And I'm going at each step I'm palpating as the patient takes a deep breath in. Is that causing any pain, any tenderness?
No.
Okay, to the right upper quadrant. And spleen is not palpable, which is a normal finding. After that, I'm going to be doing the special test for the abdomen. So the first one is called the fluid wave test. And the fluid wave test, I'll be asking the patient if you could please put your hands, the palmar aspect above the midline. Yeah, both hands like this. Yes. Okay, and then I'm going to be taking my hand and I'm going to place it right at the lateral aspect of the abdomen, and I'm going to place my fingertips right there. And with my other hand, I'm going to be sharply tapping or flicking onto the, okay, you can press down, yeah. Sharply tapping or flicking at the abdomen. Okay, that's good. And normal finding is that you wouldn't feel the fluid or a shock wave of fluid on the other side of your fingertips or the other lateral aspect of the abdomen. If you do, it's a positive finding for ascites, which indicates that there's fluid in the abdomen, but in this case it's negative and it's a normal finding. Next, I'm gonna be checking the Murphy sign. I'm gonna ask the patient to take a deep breath out, and as he takes a deep breath out, I'm gonna be palpating right at the right upper quadrant, mid-clavicular line below the coastal margin. Okay, and then and take a deep breath in. Okay, did that cause any pain?
No.
Good. So that would be a negative finding for Murphy's sign, which is a normal finding. A positive finding would mean as he takes a deep breath in while I'm palpating, if he experiences pain, that would be a positive for Murphy's sign. Next, I'm gonna be checking for rebound tenderness for appendicitis. I'm gonna be deeply palpating at the right lower quadrant, and as I push down and let go, the patient should not feel any pain, which would be a normal finding, and negative for rebound tenderness, which means it's a negative for appendicitis. Okay, so I'm gonna push down right here and let me know if there's any pain. Okay, if there is any pain, the patient it indicates that there's positive for rebound tenderness, which is an indication for appendicitis. After that test, it's going to be the CVA tenderness. Is it okay if you can sit up with your back towards the camera? And I'm going to take my left hand and I'm going to place it around the 12th rib like this. And I'm going to take my right hand, make a fist of it, and I'm going to be thumping onto here. And as you can see, the patient does not have any pain or not reacting to any pain, which is a normal finding, meaning there is no CVA tenderness. If there a positive or abnormal finding would be as I thump over and the patient reacts to pain, then that would indicate that it's positive for CVA tenderness. But otherwise, this concludes my abdominal assessment. Do you have any questions?
No.
Okay, thank you.
Did you stop it?